So you can start soon.
Yeah. Good evening, everyone. So myself, Dr. Raj Vaghani, and I'm your ophthalmology tutor at Auricle. So this session, this live session is uh, basically orientation of Auricle and about the live classes that we are going to have in the upcoming days. So we shall begin, right? Okay. So first of all, why you should choose Auricle, right? So Auricle is somewhat different from other platforms, right? So we are going to see what makes Auricle different from others. Okay, so Auricle has, first of all, recorded classes, as you can see here. It has recorded classes, it has live classes, it has practical sessions, it has exam module, it has hard copy book set as well. Okay, now what do you mean by the recorded classes? You must be knowing that the recorded classes are the classes that have been recorded previously, right? So you can study it at your convenience, at your time, whenever you feel like you get some time. So, okay, so you can study it whenever you feel free to study. Okay, so these classes also helps you to gain maximum knowledge, and at the same time it is at your convenience, right? Because the live classes, like it ends in a certain period of time, right? It has a specific time period, but the recorded classes are there for you for your subscription period. Okay, so the recorded classes are very useful for you. Okay, so it has very flexible learning. It also is provided by some of the most expert tutors, right? And it is very convenient for you to revise it anytime. So this was about the recorded classes that you can have at the Auricle here. Okay, now the live classes. Okay, so the live classes that we are having it right now. Okay, so live classes, they provide you with the concepts. Okay, so the live classes here at Auricle, basically, it is very convenient for you and it is very helpful for you. Okay, so here at Auricle, we try to provide in the live classes the maximum knowledge, right? The maximum concepts. And here at Auricle, we actually focus on your professional exams, like your university exams, right? So in your university exams, how to write answers. Okay, like if you get any question, okay, and you tend to forget some of the points, like what are the etiology of that particular disease or the particular type. Okay, and what are the causes, what are the clinical features, what are the treatment options, what are the investigations. Okay, so we try to we deliver the concepts in such a way in the live classes that you don't forget it in your real university exams, right? So in the university exams, it is going to be very helpful. Okay, it is going to be very helpful, and I can assure you that these live classes will score you maximum marks in your university exams, right? So it also provides you in-depth coverage of the topic. It by some of the most experienced educators like me. Okay, and it also provides interactive learning. Like you can always ask questions in the chat box, right? And you can always, there are some MCQs, there are some question pools, okay, in the live classes, where you can interact with the teacher, where you can participate maximally with the teacher. So the live classes is going to be very, very helpful for you. So I highly recommend to take these live classes and not to miss a single class. Okay, so because this is the orientation class, right? And thereafter, you're going to have regular classes, like regular teaching classes. Okay, so in the regular teaching classes, everything has been planned and scheduled for you such that it is in a proper sequence. Okay, so I suggest you not to miss any class and take the live classes very properly. Now, what is express exam modules? Okay, so here at Auricle, we tend to provide express exam module, which is basically your quick revision part, right? So we try to deliver your entire syllabus in less than in under 20 hours. Okay, in less than 20 hours. So this express exam module is basically you to collect every information. Okay, so you have read so many concepts. You have read a lack of concepts, like you have read thousands of concepts. So you want to summarize it and you want to write answers based on those concepts in your main exam. So here at Oracle, okay, we provide you the most uh, feasible solution. Okay, so here at Oracle, we provide you the most feasible solution for you to write your answers very properly and in a point-wise manner. Okay, so I will explain you in every topic, like what questions can be expected from this topic, right? And how you should write answers and how you should frame your points so that you get maximum marks in the particular answer. Okay, so you must be having like long answers, short essays, MCQs. Like, okay, so we are going to practice each and every part. Okay, we are going to practice each and every part uh, related to the topic. Okay, so like when I was giving my third year exams, I remember when my ophthalmology paper, my university exam. So when the paper was handed to me, the first question was somewhat I don't remember at all. Okay, I can't remember what points have to be written in it and what subpoints have to be written in it. Okay, so I forgot all the things. But later on, I remembered the main highlight points. Okay, like I have to write the etiology point, I have to write the causes, I have to write the clinical features, I have to write the treatment. Okay, so this is the way that if you remember the main headings, right? If you remember the main headings, then the sub points or the actual answers will get to you eventually. So there is a sequence, there is a method on how to write the answers and how to remember the answers and how to remember the topic effectively so that you don't forget it completely. Okay, I'll not say that you will remember each and every word. It is not possible. It is not humanly possible to remember each and every word. You can remember the concept and you can remember the sub points. Like this answer has 5 sub points, this answer has 4 sub points. Okay, what are the clinical features, what are the types, what are the classifications, right? So this is very important and this can score you maximum marks. Okay, so this is the way to study and we will see this way in our subsequent live classes. Okay, so this is the express exam module in which we'll provide a crisp, will make the whole syllabus very crisp and will deliver it to you in such a way that you will score highest marks in your university exams. Okay, so we also provide you answer writing skills from our very expert educators. Okay, now the live sessions also have sorry, here at Oracle, we also provide one-to-one doubt clearing sessions. Okay, so what are doubt clearing sessions? Like you have doubts on a specific topic or one or two topics or on some questions. So you can ask those doubts to your respective tutors, right? So if you have any doubt in the ophthalmology class, okay, in the live class also you can ask me in the chat box. Okay, I'll see and I'll answer your doubt. Okay, and you can also ask me anytime. Okay, in the next class or in the third class of the previous class doubts. Okay, anytime is okay with me. So doubts clearing session is held one-to-one on one-to-one basis. Okay, so this is very useful for you because this is student centric and you will get personal attention. Okay, every student will get personal attention, like whatever questions, whatever doubts they're asking, it will be cleared by me, right? It will be cleared by me. Regarding it, it may be regarding the topics, or it may be regarding how to write the answers, how to remember the things, how we should remember the mnemonics, right? So everything you can ask. There's no issue, right? The live sessions is meant for you and you only. Okay, the live sessions has to be understood by you and you should remember the way to write your answers, right? And you should understand the topics as well. First of all, it is important to understand the concept and then to remember the points that you have to write for the exams, right? So I will highlight every important points that you should focus on. Okay. And you can also get the hard copy notes. Okay, it is available in the Auricle app, in the Auricle website, right? So you can anytime order it, and it is basically the notes that is recorded in the recorded class. Okay, it is the it is the hard notes of the video lectures that is recorded in the Auricle app. Okay, so you can gain maximum benefit from it so that you don't have to make notes, right? And you can order it. And you can also order it using my code, that is Dr. Raj 20 for discount, right? Okay. And there are also question banks for your NEET PG preparations, right? And also for university exams that you may get some MCQs also in your university exam, right? So these question banks will be really, really helpful for you. And it is also very effective for your NEET PG entrance exam, right? So it covers MCQs for prof exams, NEET PG, and also FMG exams for foreign medical graduates that are seeking help, right? So it is very helpful for them as well. Okay, so this was about the brief introduction of what we are going to do and what are we serving here at Auricle, so that you are maximally benefited from these subsets, right? Okay. So okay, there are also practical sessions, right? So unlike many of the platforms, Auricle also provide you the practical classes. Okay, so the Auricle's practical classes are designed to provide you hands-on expert. Like you can feel it, like you're watching the lecture and you can feel it that you are studying this in your practical hall. Okay, in your practical hall. So it will give you confidence and it will give you skills on how to take your practical examinations, right? Okay, so it will be like very useful for you for the practical exam. And in the practical exams, more than theory, your conceptual understanding is tested. Okay, your conceptual understanding about the thing and your like instruments part. Okay, like you should remember every instruments and what are the functions of the instruments, what are the contraindication of using the instruments, in which diseases this instruments is used, in which surgeries this instrument is used. Okay, about the X-rays, about the instruments, and about every other things. Okay, so in the practical session, it tells you about the it tells you about how to deal with the practical exams in such a way that you score maximum marks in your practical exams. Right? So you should focus on these practical sessions as well, because practicals carry as much marks as your theory marks and is as important as your theory. So never neglect your practical sessions. Okay. So there are various kind of subscription plans here at Auricle. The foundation plan is for 3 months, and your advanced learning plan, if you want this course for the 6 months, you can also have it for the 6 months. If you want the complete learning of your current professional year, so you can buy it for 12 months. And if you want to extend it, and if you want your full syllabus or full MBBS curriculum, you can also have it for the full MBBS curriculum that is for 4 years. Okay, that will include your first, second, third, and fourth year, right? So this was about the brief introduction of the Auricle, right? So we shall start about the ophthalmology orientation program. Okay, so what are we going to do and how we're going to deal with the subject ophthalmology? And as I told you that I will be your ophthalmology tutor, which is Dr. Raj, right? So first of all, we'll see the overview of schedule. Okay, so right now what we are seeing how we will proceed with the subject further. So basically we'll have the following subheadings like anatomy and physiology of eye, optics and refraction. That will be in 2 sessions. Okay, so that will include structure of eyeball, visual pathway, the topics like light and dark adaptation, refractive errors in detail. Okay, like myopia, hypermetropia, presbyopia, and a detail about the LASIK surgery. So this will be all covered in the anatomy and physiology part. Okay, so this is kind of very important to develop conceptual building for further classes. Okay, any subject like your ENT, your ophthalmology, your medicine, your surgery. Okay, all the subjects the basic foundation is led by anatomy and physiology subjects, right? The anatomy and physiology. So it is very important before studying any topic to study about its anatomy and its physiology. Okay, so if you are studying about the eyeball, you should study about the anatomy and physiology. Okay, so then coming to the neuro-ophthalmology. What do you mean by neuro-ophthalmology? Neuro means the terms related to the brain, right? So the neuro-ophthalmology will be dealt in according to the diseases of the optic nerve. Okay, so it will be dealt related to the optic nerve. Okay, so we will study about the optic nerve, how the visual pathway is carried through the optic nerve. Okay, what are the diseases of the optic nerve, like optic neuritis, this is papilledema, optic atrophy, and how is color blindness formed. Okay, and what is amyloidosis fugans. Okay, so we'll study about these topics in the neuro-ophthalmology sessions, which will be held in 2 sessions, right? So this was about neuro-ophthalmology. Now, disorders of ocular motility. Now, what do you mean by ocular motility? Ocular motility means here your movement of your eye. Okay, so like if I'm seeing on the right hand side, so my both eyes will move towards the right, and if I'm seeing on the left hand side, my both eyes will move towards the left. So what is happening? What is triggering so that I'm moving my eyes towards right or I'm moving my eyes towards left? Okay, so this will be dealt in this disorders of ocular motility. Okay, so we'll study about extraocular muscles that help us bringing about this movement of the eyes. Okay, we'll study about the binocular single vision. We'll study about the squint. We'll study about the pseudostrabismus. We'll study about the nystagmus. Okay, so this topic will be dealt in detail in the part of disorders of ocular motility. Okay, this will be held in the one live session. Okay, now, disorder of eyelids. So disorder of eyelids. Okay, what are the disorder of our eyelids? So it will include topics like anatomy. Okay, again, it is anatomy. So anatomy is very essential before going into detail of any topic, right? So I've told you, always keep your focus on anatomy and physiology part, because if you don't know the anatomy, then it will be very difficult very difficult for you to understand the things. So it is very important to know about the anatomy of the topic. So we'll study the anatomy of eyelids. Okay. Then we'll study about the blepharitis, external hordeolum, which is also known as tri, chalazion, internal hordeolum, trichiasis, madarosis, entropion, ectropion. Okay, so these are the all topics that we'll be dealing. Okay, this may sound a little bit confusing or this may sound a little bit hard, but I make sure that this will be a piece of cake for you when we study this disease. Okay, this will be a piece of cake. So you will understand it completely so that such that you will be able to write about it and you will know about these things when these questions come in exams. Okay, so my main purpose is to explain these topics to you in such a way that it imprints in your mind. Okay, and you get the points that you are going to write in your exams. Okay, so these two mottos are of me that I have to deliver it to you, right? Okay, so okay, so this disorder of eyelids will be dealt in 2 sessions. Okay, since the topics are a little lengthy, so it will be dealt in 2 sessions. Okay, now we'll discuss about the disorders of lacrimal apparatus. Okay, like anatomy of lacrimal glands. Okay, where it is situated, what are its function, what does it constitute. Okay, we'll deal about the disorders of lacrimal apparatus. So we'll study about the anatomy of lacrimal gland. What is tear film? How is the tear film formed? What about the Sjogren syndrome? You must have studied about this syndrome in the class 12, right? The Sjogren syndrome in your pathology subject. Yeah? So you will also study about the bottom eye dichocystitis, which is a very common disease. Dichocystitis, okay, as it is becoming more and more common. Okay, so we'll study about all these things. This will be dealt in the one session. Okay. Now, disorders of orbit. Okay, so what are we going to study in orbit? Orbit is actually like for brain we have skull, right? For brain, which is known as skull. Similarly, we have So further going into detail about the ocular injuries. Okay, so ocular injuries will be dealt in the following subheadings like the terminologies. So there are many terminologies related to the ocular injuries. So we'll deal with these terminologies in the subheading of ocular injuries, right? And what are the extraocular foreign body? Like so suppose if you get a pin in your ear, if you sorry, a pin in your eye, or any small objects if you get in your eye. Okay, we'll deal how to so we'll study how to deal with the extraocular foreign body. Okay. There's also one important topic which is open and closed globe injuries, right? So open and closed globe injuries related to the eyeball. So we are going to study about this injuries, chemical injuries, thermal injuries, electrical injuries, and radiation injuries. So these are all the kind of injuries which are common to every part of the human body, right? So we'll also study it with respect to the with respect to our eyeball. Okay, so we'll study chemical, thermal, electrical, and radiation injuries. Okay, so in the next class we'll study about the ocular therapeutics. Like what are the what do you mean by therapeutic? Therapeutic means therapy, right? Therapeutic word has been derived from therapy. So we will discuss about the basically the pharmacology part. The pharmacology means the drugs part. We'll discuss how to treat the ocular disorders related to anything. Okay, eyelids, lacrimal gland, leukocystis, ocular injuries, be it related to anything. Okay, so we'll discuss about the topical eye drops, periocular injections, intraocular injections. Okay, so the most commonly used therapeutic in the disorders of eye is basically the eye drops. Okay, so if you must even you have encountered that whenever you go to a optometrist or ophthalmologist, right, for checking your eye, so he must have prescribed you a eye drop. Okay, so that your eyes does not get very dry. Okay, so eye drops are very useful and very commonly used in the field of ophthalmology. Okay, eye drops are very effective. So other mode of administration of these pharmacological drugs are periocular injections and intraocular injections. Okay, like you can inject in the periphery of the or in the periphery of your eye or in your eye itself. Okay, so they are intraocular injections and they are periocular injections. Right. So next, moving towards the anti-glaucoma drugs. Okay, the anti-glaucoma drugs. What are the anti-glaucoma drugs? How to administer them? What is their mode of action? How long they will act? What are their benefits? What are their contraindications? We'll study all this. Okay, we'll study all this in detail. Lastly, the viscoelastic substance and the lubricating agent in artificial tear. Okay, so viscoelastic substance is another class of drugs that we are going to study. Okay, and lubricating agent or artificial tear is for those who have very less tear. Okay, so normally our eyes are very wet. Okay, so such that our eyelids blink. Okay, so if I'm blinking right now, so because my eyes have produced tear, right? It is because my eyes are produced here. If my eyes does not produce tear, I cannot blink. Okay, so it is very important that our eyes produce lubricating agent, and if our eye does not produce any tear, then we have to install an artificial tear for the same. Okay, and then we'll discuss about the dyes used in ophthalmology. Okay, we'll study the dyes used in ophthalmology. Okay, now the lasers and cryotherapy. You must have heard that lasers are now becoming the effective therapy for many kind of problems, right? Lasers and cryotherapy are becoming one of the mainstay treatment of many kind of disorders. So in the case of eyeball as well. So what are the types of lasers and how these lasers are used for treating the diseases of the eyeball, right? What is the principle of cryotherapy in ophthalmology? How does the cryotherapy works and what is the mode of action? Okay, how long does it last and what are the advantage, disadvantage, contraindications, indications? We'll study about all these things in this lasers and cryotherapy part. Okay, where you must have heard about the surgery called LASIK surgery. Okay, it is very commonly done nowadays for myopia correction. Okay, the LASIK surgery. The LASIK surgery is been commonly used for correcting myopia disorder. Okay, like I cannot see very far. Okay, I have spectacles. Okay, like I have spectacles, so I cannot see very far. Okay, so I have spectacles for that. If I want, I can get LASIK surgery. Okay, so the LASIK surgery is readily available nowadays, and it is being preferred by many of the people. Okay, many of the people. So now we'll discuss about the in the further class we'll discuss about the disease of conjunctiva. Okay, so what is conjunctiva? Where it is located? What part is known as conjunctiva? It will be dealt in two sessions, right? So first of all, we'll deal with applied anatomy. Again, the anatomy of the conjunctiva, which is very important to study the conjunctiva disorders. Okay, now we'll study about infective allergic conjunctivitis, what is pterygium, what is the shape of pterygium, how is pterygium formed, what are the risk factors, what are the precipitating factors. Okay, like these are the subtopics. Okay, so now also discuss about the discoloration of conjunctiva, testing the conjunctiva. Okay, the condition like the conjunctiva. Okay, we will discuss everything about the conjunctiva, diabetes course, and the question in your exam. We will discuss the each of your exams in detail in the lives. The cornea, what is cornea? Which are diseases of cornea like infected keratitis, corneal ulcer, non-ulcerative keratitis, corneal degenerations, keratoconus, and corneal surgeries. Okay, so we'll discuss about each of these topics in detail in the following headings. Okay, like what are the causes for these disease, what are the clinical features of this disease, what are the symptoms that you get, what things you should avoid while you're having this disease. Okay, so we'll discuss about the disease of cornea as well. Similarly, we'll discuss about the sclera, which will include episcleritis, scleritis, what is blue sclera, what is staphylomas and its types. Okay, we'll discuss about sclera in detail. Okay, and it is a very small topic. The sclera is a very small topic. Okay, now what is uveal tract? Uveal tract is not a single thing. It is a tract, meaning it comprises of two or three things. Okay, so we'll discuss about its applied anatomy. What does it include? What is structure? Diagram of uveal tract is very important for university exams. Okay, so we'll also discuss about the diagrams. Okay, I will also tell you in our live sessions that how you should draw a diagram. Okay, so when you're writing university exams, the examiner expects that what you're writing in paragraphs, right? The examiner expects that there should be a schematic diagram related to what you're writing. In every page, whenever you write in your university exams, in every page, keep the left-hand side for your answers and keep the right-hand side for a diagram. Okay, now I'm not saying you should remember each and every diagram or you should practice each and every diagram. It is not the way, it is not possible, okay, to study each and every diagram. You should just draw it schematically, okay, like you're writing a classification path, okay. So you should write in a flow chart. You're writing pathophysiology of how this disease is developing. So you should write a flow chart, like this thing first happened, then an arrow, like this thing first happened, then again, this thing happened, then this thing happened, okay. So this flow chart makes the examiner, okay, it takes the less time for the examiner to examine you and to check your answers, and it gives a positive impact on your knowledge, right? So always write in the form of flowcharts, in the form of diagrams. Okay, so you should just schematically draw the diagram, not exactly the diagram which is given in your book. Okay, the labeling should be correct. The labeling of any diagram should be correct, and it should be relevant to the topic that you're writing. Okay, so we'll discuss the diagrams in each and every topic, right? So we'll discuss the diagrams. Okay, so diseases of uveal tract will include uveitis, the anterior uveitis, intermediate and posterior uveitis. We'll also discuss about endophthalmitis, panophthalmitis, what is degeneration of iris, what is iris, where is it located. Okay, we'll discuss everything about these topics. Okay. Now we'll also discuss about the disorder of lens. The very important topic which comes in the disorder of lens is cataract. Okay, so the cataract is one of the major cause of blindness in India and in the world also, right? So it is a major cause of blindness in India. So cataract can be congenital or acquired. So it can be present from birth or it can be acquired during your later period of life. Possibly mostly it happens in the elderly group. Okay, that is after 60 years. Okay, so whenever you visit the hospital in the department of ophthalmology, you will see 80% of patients will be of cataract. Okay, rest 20% will be of some other diseases. So cataract is that much common in India. Okay, so how do we manage this condition? What is the option of cataract surgery? And how do you perform cataract surgery? The basic method. Okay, we'll not go into the every detail of the surgery. We'll just study the steps in brief. Okay, and we'll study how patients are selected for the surgery. What are the advantages? What are the disadvantages? What are the contraindications of the surgery? And how to manage it after the surgery. Okay, so post-operative management of any surgery is as essential as during the surgery. Okay, so post-operative management is very essential. So complications of post-operative management, like after you have undergone cataract surgery, what things you should do to prevent any complications that could arise from cataract surgery. Okay, then again, we'll discuss about the displacement of lens. So this is all about the lens, and our main focus here would be the cataract surgery. Okay. Now, similarly, after cataract, the most common ophthalmology disease is glaucoma, right? So cataract and glaucoma are the two, you can say, are the two main diseases that we study in ophthalmology. It is two most important diseases. Okay, so you will definitely get one or two questions of cataract and one or two questions of glaucoma. Okay, it is inevitable. Like there is no paper in which the questions of cataract or glaucoma is not good. Maybe even if it's of 1 marks or 5 marks or 3 marks or 10 marks or whatever marks, but there will be a question on cataract or glaucoma, right? So glaucoma will be dealt in 2 sessions. Okay, so glaucoma again will deal with the applied anatomy part, definition of glaucoma, how does glaucoma develop, and what are the types of glaucoma. This congenital, primary angle closure, primary open angle. Okay, what do you mean by angle? We'll discuss. Okay, so we'll discuss about each and every part. What is the primary glaucoma? What is secondary glaucoma? And how do you treat this condition of glaucoma? Like there are different kinds of surgeries for managing glaucoma. So we'll also deal with this surgical procedures of glaucoma, right? So after glaucoma, we'll discuss about the disorders of vitreous humor. So you must have heard about these two terms, that is aqueous humor and vitreous humor. Okay, so there are two humors in the eye. Okay, aqueous humor and vitreous humor. So they are disorders of vitreous humor. Okay, so the most common disorder is persistent hyperplastic primary vitreous, which is also known as PHPV. Okay, in short form, it is known as PHPV. Okay, it is one of the most common diseases of the vitreous humor. Okay, now disorders of retina. Okay, diabetic retinopathy we'll discuss. Okay, it is a it is also a very important presentation that you may encounter in your ophthalmology department, because the people having diabetes, okay, uncontrolled diabetes for many years, they develop diabetic retinopathy as the complication of their diabetes. Okay, because they have uncontrolled diabetes, because of the sugar spike, they develop this condition, diabetic retinopathy. Okay. Then we'll also discuss about the retinal artery occlusion, retinal vein occlusion. What is retinopathy of prematurity, which is commonly termed as ROP. Okay. What is hypertensive retinopathy? And what are macular disorders? What is macula? Okay, we'll study about this. What is macula? What is fovea? There are different parts of the retina. Okay, there are different spots in the retina, the macula and fovea. Okay, we'll discuss about these things. Right. So at the end, we'll also discuss about the practical ophthalmology part, like what is Snellen's chart, how is it used? Okay, Snellen's chart is basically used for color blindness people, right? It is basically used for color blindness people. And this is a chart specifically designed for differentiating some of the colors, okay, like red color, green color, blue color. Okay, so these so the main color blindness is of red or green color only. So we'll discuss about how to use this chart in the color blindness field. Okay, you may get this chart in your practical classes. What is leukocoria? What is tonometry? Tonometry is the measurement of your intraocular pressure. Okay, right here in your brain, you have intracranial pressure. You must have heard of this term, intracranial pressure. In the brain, there's some pressure which is known as intracranial pressure. Similarly, in eye, there is pressure termed as intraocular pressure. So how to measure this intraocular pressure is termed as tonometry. Okay, we will study how to measure this tonometry. And the instrument used in ophthalmology. The instruments will be regarding the surgeries during cataract surgery, during glaucoma surgeries, or during any other surgeries, that what are the kind of instruments that you use for different kinds of surgeries. Okay, so we will discuss about these practical ophthalmology also, and it will be dealt in 2 sessions, because this is very important, because you must remember each and every instrument, and you should remember how to explain the instrument to your examiner. Okay, so you have to explain the instrument like these are its uses. This is used for this condition. Its contraindication is this, and it has following parts. This is known as a blade. This is known as the joint. This is known as the handle. Okay, so anything that may be. Okay, so you must be knowing the parts of the instrument, the uses of the instrument, and the contraindications of the instruments. Okay, so I will tell you about the instruments, basic things that you must know for your practical exams. Okay. Now, after that, after we have completed whole of our subject, we will have 3 to 4 revision classes, right? We'll have 3 to 4 revision classes, and we will cover each and every topic. And I will give you some questions as well, okay, to practice. And I will also tell you how to write the answers in your final exams, okay? Because that will be the time when you must be knowing everything in a very crisp plan. Okay, so you cannot revise each and everything before the exam, before the day of the exam. Okay, so you must know how to write the answers. Okay, which will uh, create an impact on your brain, such that even if you don't revise it on a day before, you must know that what you have to write if you get the question of the top, right? So you have to deal in such a way that you must remember, at least you must remember what are the points that you have to write. I'm not saying that you have to remember each and every facts, each and every figures, each and every definition. Okay, I'm not telling you to remember each and everything. Okay, first of all, focus on how to memorize. Now, how to memorize the different subtopics that you're going to write your answers under. Okay, so it is very important on um, remembering the subtopics, right? Like the headings, the causes, the physiology part. Okay, and then you can easily remember, if you remember the causes, you can easily remember 1 or 2 points. Okay, and you can write your answers on the basis of that 1 or 2 points. It will be very helpful. Okay, so this is the way to write your answers, and not just remembering each and everything from a book. It will never be helpful. Okay, so thanks for watching this session. And if you have any doubts, you can contact me anytime. And you can also download the app Auricle. You can get it on Android on the Google Play and on the App Store as well, on the Apple App Store. And if you want to know more about the Auricle and about the live classes schedule, you can follow our YouTube channel and also on the Instagram, Telegram, and Facebook channels, right? So thank you so much for your patience listening, and we'll meet soon. I hope we'll meet soon again for the next upcoming live session. Okay. Thank you very much.